Phoebe surgical oncologist Dr. Troy Kimsey is here to talk with us about breast cancer. Obviously, breast cancer is much more common in women. Just how common is it?
Well, it's fairly common. So the lifetime risk for women is about 1 in 8 women over their lifetime will develop breast cancer. So that's about 13% lifetime risk. So pretty common.
And we do focus on women a lot. Men can get breast cancer as well, though, can't they?
They can. It's certainly more rare in men, but everyone's born with some amount of breast tissue, and so that puts us all at risk of developing breast cancer. So we usually think of about 1 in 100 cases of breast cancer that are diagnosed will be found in men.
What are the current screening recommendations for women?
Yeah, we use the American Cancer Society screening recommendations, which recommends women at average risk to begin their screening mammograms at age 40. We also recommend anyone with a first-degree relative, so mother, a sister, a daughter with breast cancer, that you start your screening 10 years prior to the age of their diagnosis. So if they're diagnosed after age 50, then we recommend you begin your screening at 40 like we do with everyone else. But if they're at a younger age when they were diagnosed, we recommend you start your screening about 10 years before the age of their diagnosis.
Now here at Phoebe, we offer 3D mammography. Why is that an advantage? Why is that better?
Yeah, so when we think of mammography in general, basically it's an x-ray of the breast, and that allows us to detect shadows or different densities within the breast, or even certain patterns of calcification that raise concerns about whether an area needs to be biopsied or not. 3D mammography is a newer technology with mammogram that looks at a little more detail of the breast. So it's definitely utilized widely, but it's most helpful in patients with dense breast tissue. So in general, younger age patients have denser breast tissue, and then some people, just based on their biology, have denser breasts and would benefit from 3D mammography.
What are risk factors that women need to be aware of?
Yeah, so there's general risk factors that really you can't change, and one is being female, obviously. So way more prevalent in females than males. Older age is a risk factor for breast cancer, but also a family history of breast cancer, certainly a genetic mutation that increases your risk of breast cancer, and then a prior history of breast cancer in that patient increases their risk of developing a second breast cancer. Then there's other factors that are specific that women can alter. One is hormone replacement therapy, which is pretty common, especially in that group of older women, postmenopausal women. A lot of them are on hormone replacing therapy, and that does increase the risk of developing breast cancer. Then there's risk factors that are general to all cancer development, and that's sedentary lifestyle. Obesity in particular can increase estrogen levels in the body and increase the risk of breast cancer. And then smoking increases the risk of breast cancer.
You mentioned genetic mutations. Talk to us about genetic testing that's available here at Phoebe and how that works.
Yeah, so this is really a fascinating field that's evolved a lot over the last 10 years. So when we started this journey, there were 2 specific genetic mutations that we knew led to an increased risk of breast cancer, and that's BRCA1 and BRCA2. Over the last 10 years, that has continued to grow as we study and understand more genetic mutations and the risk of developing cancer. So some are specific to breast cancer, but we also know of a lot of genetic mutations that lead to other types of cancer.
If someone has that genetic testing and it comes back positive that they have one of these genetic mutations, what's the next step?
Yeah, so it's really important that we know those mutations, because we really can now really understand their lifetime risk of developing all sorts of cancers. So it allows us to evaluate that patient. There are certain cancers, such as breast and ovarian cancer, that we can actually offer risk-reducing procedures like mastectomies if someone has a significantly elevated risk of breast cancer. For ovarian cancer, we can offer removal of the ovaries. There's other cancers like pancreas and gastric or colorectal that we can offer more often, or even screening at a younger age to begin to look for areas of concern. So either we can do risk-reductive procedures or recommend a closer surveillance and earlier detection in those patients.
The Phoebe Cancer Center obviously is the largest, most advanced cancer center in this part of Georgia, one of the busiest in the whole state. What kind of treatment options do we have here for women who do end up with a breast cancer diagnosis?
Yeah, so we have a very good multidisciplinary approach to patients that are diagnosed with breast cancer. So every patient that's diagnosed with breast cancer goes through our weekly multidisciplinary tumor conference, where we have surgeons and medical oncologists, radiation oncologists, radiologists, pathologists, and a whole team of people, including the genetics and the clinical trials team. And we discuss those cases and decide what is the best treatment schedule for that patient. We also have nurse navigators who help, because there's a lot of different appointments and a lot to navigate in that process. That diagnosis obviously can be overwhelming, and there's a lot of information. And so having our nurse navigators that help those patients navigate through that process. But most of our patients will require surgery, to some degree a discussion about either chemotherapy or hormone therapy, and then a discussion about radiation therapy. So that whole team of people come together and help guide our patients through that process.
Well, we appreciate you helping to lead that team, and thank you for sharing this information with us today.
Absolutely. Thank you for having me.